Hello, and thank you for joining us and watching Region 8's Early Childhood Needs Assessment virtual report. My name is Lou Ann Hayes, and I am the Regional Council Manager for Birth to 5 Illinois, Region 8. We cover Carroll, Daviess, and Stephenson County in beautiful northwestern Illinois. This recorded session will provide an overview and the findings from the Birth to 5 Region 8 Needs Assessment, as well as talk about the strengths, needs, and recommendations for improving access to and enrollment in early childhood education and care programs in Northwest Illinois. A link to the full report can be found in the description below. If you would like to turn on the closed captioning, click the CC icon at the bottom of the video, and this will turn on the captions. If you want a language different than English, click on the gear icon for settings, click on subtitles, and then auto translate. And then from there, you can scroll down to pick the language that you want. In 2021, the Illinois Commission on Equitable Early Childhood Education and Care Funding issued a report with findings that highlighted the inequities in early childhood funding in Illinois and the need to create a better statewide infrastructure to support early childhood professionals, expand services and programs for families and caregivers, and increase the enrollment in ECEC programs. The report focused on the importance of addressing racial inequities and the need to include local voices in the conversation that funders and decision makers were having about early childhood education and care. To provide a structure for communities, families, and caregivers to engage with the data and share their experiences, a new statewide infrastructure was created across 39 regions, all of which align with existing Illinois State Board of Education regional offices of education boundaries, but operate independently. Birth to 5 Illinois regional boundaries align with the school districts instead of strictly following county lines, which helps with gathering and interpreting data because many early childhood services are provided by or tied to school districts. With the exception of Freeport, our region, Region 8, is mostly rural with small towns filling the landscape between farms and fields. Agriculture is the region's biggest industry, with the largest exports being grain, cattle, and pork. Joining me in the Region 8 office are Dean Wright, our Family and Community Engagement Specialist, and our Administrative Support, Todd McKenna.
Hello, I'm Dean Wright, the Family and Community Engagement Specialist in our region. The experiences and knowledge families, caregivers, and early childhood professionals gain while navigating the complexities of the state's early childhood education and care system are valuable, and understanding their lived experience in the local context is vital for decision makers to ensure communities have access to the programs, services, and supports they need. To this end, Birth to 5 Illinois was created to harness family and caregiver voices in early childhood education and care and serve as a bridge between the communities and policymakers so family, caregiver, and professional experiences can guide the decisions made to expand or enhance services across the state. Our mission is to create a statewide regional infrastructure that will amplify the input from communities in the development of policies and funding priorities. We support the mobilization of communities to build and sustain equitable access to inclusive, high quality early childhood services for all children and families in the state of Illinois.
Hi everyone, I'm Todd McKenna, Regional Administrative Support for Birth to 5 Illinois, Region 8. We envision that our work will help all stakeholders reimagine a more equitable early childhood education and care system that respects family and community voice and works to ensure it is centered at every level of decision making in Illinois.
We have three main values and goals. First, we must prioritize family voice. Through this transformation centered on authentic family and community engagement, we will address the inequitable distribution of resources and services and rebuild our state's early childhood education and care system. Second, we must address the racial and socioeconomic inequities that exist in our early childhood system. To move our early childhood education and care system to one where racism is no longer impacting a child's success, we will work to dismantle barriers that have limited access to high quality services for minoritized children in every corner of our state. And third, we will use the collective impact model to shift the current early childhood system to influence policy and funding at the local, regional, and state level. Birth to Five Illinois will use community-driven feedback to build a system that harnesses knowledge directly from families and providers and encourages decision makers to ensure new and/or expanded services are created to meet community needs.
Two critical parts of the new statewide infrastructure are family councils and action councils. Located in each of the 39 regions, the councils provide feedback on quantitative data from the Illinois Early Childhood Asset Map, or ICAM, and the Illinois Network of Childcare Resource and Referral Agencies, or INCRA, to help contextualize the data at the local level. The councils meet twice a month in virtual, in-person, or hybrid meetings. The family councils are comprised of parents, caregivers from a wide variety of family types: single parents, adoptive and foster parents, caregiver of relatives, teen parents, two-parent families, multi-generational families, and more. They prioritize the voices of those who have not been involved in this type of work before. We want to highlight those who have been involved in our Region 8 Family Council over the past year and thank them for sharing their experiences with the early childhood system. Ciasia Morris, Casey Ewell, Nakia Brown, Lauren Dick, Ashley Palizzi, Brianna Dasher, Brittany Alexander, Brooke Frank, Jane West, Bethany Dessau, Becky Schultz, and Samantha Edler.
Action councils are comprised of early childhood education and care professionals, healthcare providers, faith leaders, elected officials, and other community members. Each Action Council reserved 2 seats for parents and caregivers to ensure family voices were included in every discussion. Action Council members were invited to bring additional aggregated data on programs and services provided by their agency or organization to complement data from ICAM and INCRA. We extend thanks and gratitude to our Region 8 Action Council members: Amy Schoenhar, Kenny Lewis, Ashley Harms, Stephanie Lewis, Devin Spellman, Sarah Kuhlemeyer, Roberta Kapp, Stephanie Koklanis, Janine Patty Anderson, Illinois House Minority Leader Tony McCombie, Chandra Morris, Emily Dixon, and Amanda Myers.
Beyond the council meetings, additional qualitative data was collected community-wide through focus groups and interviews, and all council members were invited to provide input on each section of the Early Childhood Regional Needs Assessment. Council members developed the strengths, needs, and recommendation next steps that are unique to each region. Regional teams, along with the support of their Action and Family Council members, created a dissemination plan and are holding community meetings virtually and in person to share their report's findings. The following slides highlight some data that was discussed by council members and provides insights into the early childhood education and care landscape in our region.
82% of Region 8 residents are white, while Black residents make up 6% of the population and Hispanic Latinos represent 5% of the population. The median household income is $54,167. Region 8 has lost over 4% of its population since 2010. There are 5,132 children under the age of 5 in Region 8. Part of the conversation with council members was around priority populations, defined by the Illinois Early Learning Council as groups that have been historically underserved by early childhood education and care programs. While data on children and families from priority populations is limited, there are a few things to note about Region 8. The priority populations include children living in families in poverty or deep poverty, children living in areas that lack adequate and quality licensed childcare options, children with disabilities, and children who come from primarily Spanish-speaking homes. According to the 2020 U.S. Census, 45% of Region 8's children ages 5 and under live at or below 200% of the federal poverty level, meaning that many of them were eligible for several state-funded early childhood programs. School districts with the highest rates of poverty are Freeport at 65%, River Ridge, which includes the communities of Elizabeth and Hanover, at 53%, and Dakota at 52%. Additional information about priority populations was gathered through surveys, interviews, and focus groups, and is included throughout our final Early Childhood Regional Needs Assessment report.
Community collaborations are an important part of the early childhood landscape. Local early childhood community collaborations bring together community agencies, organizations, and individuals with a shared vision or goal. They understand the importance of improving early childhood education and care for children, caregivers, and providers. Region 8's local early childhood collaboration, the All Our Kids Network, AOK, and coordinated intake covers all 3 counties in the region. In Region 8, the AOK network is a collaboration of 43 community partners throughout the region committed to building and supporting a community system that assures the growth and development of children aged 0 through 8 and their families. This network works to ensure children are born healthy, stay healthy, and enter school ready to learn. Members meet monthly together as a group and as needed in various community work groups to complete the strategic plan initiatives. They share information and data regarding agency changes, upcoming events, new or revised programmatic requirements, program eligibility, and other agency-related news. Additionally, several early childhood care providers, agencies, and educators participate in Freeport's Early Childhood Consortium, ECC. The ECC is a collaboration of early childhood providers and agencies that share resources and support each other to provide a system of care for young children and their families in our communities. The ECC hosts, supports, and coordinates staff development activities, parent and family support programs, communication among agencies, shared expertise and consultation, staff recruitment assistance, equipment sharing, and curriculum support. The ECC also supports awareness of the Highland Community College Early Childhood Education Scholarship.
Region 8 is home to a variety of early childhood education and care programs and providers, all servicing children based on the licensing, funding, and staffing requirements. But access to early childhood programs and services is not available and equitable for all the region's families. Wait lists at childcare centers and the availability of childcare in our region is a significant barrier for families and caregivers, as there are not enough spots for families to enroll their child in care across all programs in the region. This is particularly true for parents, families, and caregivers with infants who work second or third shift. Options for these families are all but non-existent in some areas. As one community member stated, sometimes wait lists at daycares are years long. As a result, families and caregivers reported that they were highly reliant on grandparents or other family members to provide childcare for their children. There are publicly funded preschool options available in the region, such as Head Start and Preschool for All. However, not all programs are full day, nor do all provide transportation to and from their program, leaving many families who qualify for publicly funded preschool choosing not to enroll them in a publicly funded program. Fortunately, there is a program that families can apply to through the Illinois Department of Human Services, IDHS, called the Childcare Assistance Program, CCAP. CCAP provides families with limited access to financial resources and access to quality, affordable childcare while allowing caregivers to continue working and/or completing their education. All families are required to cost share on a sliding scale based on family size and income. Unfortunately, not all families who qualify for the program are aware of the program or understand how to apply. Many providers will not accept CCAP due to delayed payments from the state.
Through community meetings, focus groups, interviews, and surveys, families in the region reiterated the urgent need for more affordable childcare and preschool options, staffed with providers and teachers that are well paid, supported, and who will want to continue working in early childhood long term. Similar to other areas of the state, Region 8 is experiencing a staff and teacher shortage, preventing programs from operating at full capacity or expanding to meet community needs. Staff turnover is a big contributor to the workforce shortage, and it remains a concern among community members in Region 8.
Improved communication between parents, families, caregivers, and their respective preschool providers, schools, and child care centers would help build stronger family engagement in Region 8. Improving access to information regarding preschool options in the area and preschool screenings are important if we want to make sure all of the children who qualify for preschool and preschool for all programs are being signed up.
Community and council members identified several strengths of the early childhood system in the region. Over this regional needs assessment project, we learned our region has a regional education infrastructure capable of educating and training the next generation of ECEC workers and teachers. It has a strong collaboration of local leaders and childcare professionals dedicated and determined to improve our local system. And it has communities that are committed to improving the lives of their residents, families, and children. But we also learned that if we are to better prepare our children for the future, we will need to improve our local early childhood education and care system. This will require us to grow and better equip an ECEC workforce for the 21st century, address the ever increasing slot gaps our families are experiencing in securing available and affordable childcare, and provide stronger support systems for our parents, families, and caregivers who care for our young children.
Based on community and council conversations, recommendations have been made on how early childhood education and care programs and services can be improved for families in the region. Recommendations will be presented to lawmakers, state agencies, local elected officials, and funders so they can better understand the needs of families in the region and share their recommendations with them so they can see how to best meet those needs. In Region 8, we are recommending implementing a campaign that works to grow and improve our local ECEC workforce by supporting an increase in wages and benefits for ECEC workers, support the streamlining of online childcare education and training, and increasing our efforts in our communities and in our high schools to recruit new and young workers to the ECEC world. We are also recommending we work collaboratively to increase the availability and affordability of childcare by pursuing the development of new licensed childcare centers and family homes in all parts of our region by making sure as many families that qualify for the state's CCAP program are enrolled in that program, and by working with our local educators and school administrators to expand the state's Preschool for All program in our area. Finally, we are recommending we work together to build a stronger support system for families with young children by expanding ISBE's prevention initiative, improving family engagement in our schools, and advocating for a family-friendly public transportation system.
This summer, we will be out in the community talking to more families, providers, and stakeholders about their experiences with early childhood education and care, and we want to talk with you. We invite community members, families, and early childhood professionals to join the conversation by filling out a council interest form. Please go to www.birth-to-5il.com/councils or click the link in the description to get involved. Interest forms will close later this summer, which council meetings fully resume in August. Birth to Five Illinois is proud to be a department of the Illinois Network of Childcare Resource and Referral Agencies, and we are grateful for funding from the Illinois State Board of Education and the Illinois Department of Human Services. I'd like to thank you for watching, as well as our state partners for their support. We encourage you to stay in touch with us by visiting our regional page at www.birth-to-5il.com/Region 8, joining our Facebook group, or reaching out to me directly via email at lhayes@birth-to-5il.com. Links to our pages along with my email address are available in the description below. Thank you for your time. We look forward to connecting with you soon.